Hi everybody, my name is Jennifer Zapatero and I'm going to be doing my presentation on the herpes simplex virus. This is my audience, my brother and my cousin. Okay, so let's begin. So I'm going to give you a brief history about the herpes simplex virus. Herpes dates back to 2,000 years ago during Greek civilization. The word herpes actually means to crawl in reference to the slow spreading of the lesions, as in like the blisters. There are two types of the herpes simplex virus. The first one is called HHV1 for human herpes virus 1, and the second one is HHV2 for the herpes simplex virus 2. Type 1 is commonly known as oral herpes, and type 2 is commonly known as genital herpes. HHV1 was actually the first human herpes to be discovered. In the mode of transmission, there are no vectors involved in the transmission, so that means humans are the only natural reservoirs. So that means like we are like the only carriers of the virus. So the basics about herpes simplex virus, it comes from the genus Simplex virus, and the structure, it's a double-stranded DNA, and it's enveloped in a polyhedral capsid, and this is what it looks like right there under a microscope. The virus, it actually attaches to a host and it replicates in the DNA. I'm sorry, I meant the nucleus. It's transmitted sexually and by close contact. It is not threatening unless it's neonatal herpes. That means whenever an infant gets the herpes, it could reach to their brain and it could kill them. HHV1 is 60% of Americans have already been exposed to it. So a lot of Americans aren't aware they might already have it, but it's never been triggered, so it's never appeared on their face. HHV2, 17% of Americans over 12 have already been infected with the genital herpes. The pathophysiology, so the virus first enters the body through cracks or cuts in the mucous membrane, so like around the nose, the general area, your mouth, and the virus is reproduced in epithelial cells near the site of infection. And once that happens, inflammation and cell death is produced, and that is the result of localized lesions on the skin, so the blisters. Infected cells fuse with uninfected nearby cells, and they form a structure called a syncytium. The herpes virions spread from cell to cell. In the process, virions avoid the host antibodies. After the first infection occurs, the virus enters the sensory nerve cells. Cells are carried by cytoplasmic flow to the base of the nerve where they remain latent. So the virus, once it infects you, it stays hidden within your cells until it's triggered. People with HHV1 or HHV2 have reoccurrence during their lives as a result of the activation of latent viruses. The populations, herpes simplex occurs worldwide, so it doesn't just happen in one specific area. It is one of the most common STDs, and it affects both men and women and children. Neonatal herpes is caused mainly by human herpes virus 2, and its mortality rate is 30% oral cutaneous, and 80% is in the central nervous system when it's infected. By age 2, 80% of children have already been infected with the herpes, the type 1. And HHV2 is acquired between ages 15 to 29. So that's like a breakout that would happen on the child. Okay, the symptoms, HHV1, which is the oral herpes, you get painful, itchy skin lesions on your lips, and it's commonly known as cold sores or fever blisters, and they usually last about 7 to 10 days. You get fever, malaise, and muscle pains are also symptoms. And the virus is triggered by aging, immunosuppression, or physical and emotional stress. So you might see that you usually get them whenever you're stressed out or after you just, recovered from the cold. And then HHV2 is the genital herpes. It's mainly transmitted sexually. The lesions are like those of the oral herpes. They're also painful, and you also have painful urination and discharge, muscle aches, and pain in that area wherever it's infected. So that's the oral herpes, and that's on the genitals. To diagnose this, doctors can, easily just look at your skin and assume that it's oral herpes or genital herpes, and by the characteristics. And if the doctor's not sure that it's oral herpes or genital herpes, they'll usually draw blood and run some lab tests, so they can for sure know that that's what it is. And for treatment, there's no cure for it. So the only thing you can do is control the symptoms. And both types can be controlled by antiviral medications like valacyclovir, which is Valtrex, or Zoyvorix, or I can't say that word, but hydrodeoxyuridine. Topical applications are also available, such as Abreva that you can put on your lips. The prevention plan and steps for healthcare workers, they can reduce the exposure to the herpes infection by wearing gloves. And if they have any visible lesions, then they should not come in contact with any patients whatsoever, especially newborn children. The daily dose of oral medications and the use of condoms should be used to reduce spread of herpes to a sexual partner. Condoms alone, they're not as effective. So you also have to make sure you're taking medication at the same time because they provide little protection. And sexual abstinence and a faithful marriage between uninfected partners is the only way of preventing the spread of herpes simplex virus. People who have HHV1 should not kiss anyone, especially babies, because they could get neonatal herpes and die from it. Conclusion: research to find a cure is still going on, as scientists know the disease is incurable. So the only way to control it and prevent the spread is by taking precautions. Make sure to use contraceptives and get tested yearly, and be careful that you don't use other people's things. Like, say I had a cold sore, don't drink out of my cup, or don't use anything that I put in my mouth. And that's it. Thank you for watching.